Since telemedicine is associated with technology and its advancement, I'd be remiss if I didn't discuss some of the fun gadgets you can use when providing virtual care to patients. As we discuss a sampling of these technological tools, you should keep in mind a few things. First, technology is rapidly evolving, so the items I discuss here could potentially be outdated when you're listening. That said, the general themes should continue to apply. Second, just because the technology is available doesn't mean it's cost-effective or the best clinical option. Along those same lines, you might not have access to these tools in your practice. Now let's dive into the fun. Several companies make a stethoscope that can work with a patient's smartphone to transmit the sounds to you, either in real time or asynchronously. Some even can analyze the sound waves and detect murmurs, rhonchi, wheezing, and so forth. Of course, patients need to be instructed on how to use these tools, not just from a technological perspective, but from a medical perspective. If you want to hear the aortic heart sounds, the patient needs to know where to place the stethoscope. This can be done easily through video or images. In my experience, the biggest challenge with the remote stethoscope is the quality of sound. Because of the poor audio quality, my colleagues and I opted to not continue with its use in our virtual visits at that time. My group had better luck with tools that improved remote visualization. Patients can use a remote otoscope to allow you to visualize the eardrums. A similar tool with a tongue depressor can help patients provide you with a good view of their throat and tonsils. It can be difficult to get a good view when a patient uses their smartphone to try to take a photo of their tonsils. You often end up only seeing their tongue. There are smartphone applications that allow patients to perform electrocardiograms or ECGs at home. For improved accuracy, some companies even provide one large sticker with all the leads already placed in the proper position. The patient just has to line the sticker per the instructions, and all the leads should be in the correct locations. There are also programs and tools to allow patients to perform ultrasounds on themselves. At the time of this recording, this is not a widely available tool, but imagine the potential. A patient presents with classic gallstone symptoms, and you can see the ultrasound images confirming the presence of gallstones during the virtual visit. As technology advances, these types of possibilities will become more and more common. It's the new frontier of medicine. Of course, for those tools to be helpful, you have to feel confident that the information they provide you is accurate, and this is not always the case. One example is smartwatches that can measure blood pressure. Currently, these tools are not reliably accurate, and a traditional arm cuff is recommended by the American Heart Association. You should also think about how user-friendly the tool is. If a patient is going to have difficulties using the tool accurately, it may make the encounter less, not more productive. Ease of use also applies to you. Does the device integrate with other tools you use, notably the electronic health record? You should also consider cost. Who will pay for the gadget? Does it allow you to provide better medical care? Ever-advancing technology expands the possibilities of virtual care every day. It can be easy to get distracted by the excitement and forget the larger picture. By remembering to consider reliability, accuracy, ease of use, and cost-effectiveness, you can more objectively decide what tools to incorporate into your practice and when, to get the best results for you and your patients.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how MedMastery can help you become a great clinician, make sure to watch the About MedMastery video. So thanks for watching, and I hope to see you again soon.